The Luxator Periotome is a periotome with a very sharp edge that allows you to cut the periodontal ligament and that way luxate the tooth so that it can be extracted from its socket. The edge of this instrument is not designed to be used as an elevator, so if you use it like an elevator, the edge will be damaged and lose its sharpness, and in time there may even be fractures on the edge of the periotome. I recommend to use this grip when using the periotome to reduce the risk of slipping and injuring the patient. It is wise to use the non-working hand as a support when luxating the tooth. I usually start with a small luxator, and once I feel that I have created access to the periodontal ligament, I change to a broader luxator. I try to use my index finger to support the working part throughout the whole time. When using the periotome, you should use a side-to-side movement along the axis of the root to cut the periodontal ligament. This way, you minimize the risk of fracturing the bone surrounding the root. My personal favorite is the Luxator P. It's a very sharp periotome with a small handle that allows you to use a pen grip. This periotome is titanium coated so that it can keep its sharpness. When using the Luxator P, you can use your fingers as support and it minimizes the risk of slipping and injuring the surrounding tissue and the patient. The technique is to use a side-to-side movement along the axis of the root and to progressively cut deeper and deeper into the periodontal space until the root is loose and can easily be removed. There are different shape and angles to this instrument. This way you can use this periotome in different situations. This instrument is ideal for luxating the distal part of the last molar and to avoid tuber fractures in the maxilla. Usually, when a root is sufficiently luxated, it can be removed using a pair of tweezers. I usually use a pair of diamond-coated tweezers, or like in this case, root pick. Luxator Forte is an elevator with a strong working part. It is designed to be used as an elevator with a rotating movement. It is designed to put a pressure on the tooth and pry it in the direction out from the alveolar socket. Its edge is not sharp at all, and you won't be able to cut into the periodontal ligament. The only way I use it during an extraction is when the tooth is properly luxated and I only need a little bit of force to deliver the tooth from its socket. So in my clinical workflow, I only use it at the very end to avoid damaging the edges of my luxators.